Xavier and Ochsner are partnering to work together towards establishing a medical school here in Louisiana. Our purpose is to remedy prejudicial and inequitable structures in healthcare in the United States and abroad, and to embark on a journey that advances health equity for all the peoples of this nation.
Creating new jobs and training new physicians is critical. But just as important is the need to build a workforce that reflects the values and diversity of the amazing patients and community members that we serve.
Such exciting news. Less than 24 hours ago, Ochsner Health and Xavier University of Louisiana made this historic announcement to build a joint college of medicine. The two institutions working to create a strong physician pipeline that addresses longstanding inequities within the nation's healthcare system and builds the healthcare workforce for the future. Not only will this bring jobs to New Orleans, it'll also bring advanced efforts of healthcare and education equity, and it'll be the first HBCU medical school in the state. Joining us this morning to explain this endeavor is University President Dr. Reynaud Verrett. Thank you so much for being with us.
Good to be here.
And you did announce a medical school in April. When did this partnership with Ochsner form? Was that something that before you announced you already knew, or that's something that came about later?
It wasn't something that we fully knew because but it's something that we've been working at together with Ochsner for so many years. We knew that Ochsner was actually had been a very steady, trusted partner in the programs at Xavier, and we had been having these conversations sometimes. The announcement yesterday was actually to begin the yeoman's work to actually do the planning, to do all the development work, to actually put the curriculum together, and to come back with a plan to our boards of trustees. This is the moment of the launch of our real work to be done together. We've known that we've had a good relationship together, and we could work together and build programs, and we'll continue to do that.
Any timeline on when the school will open?
The timeline is still based on our planning, but I expect that it would take us several years, probably 3 years or more, to get the school to open, because we have work to do. We have accreditation work to do. There's funding, there's building, there's all sort of details that have to be.
And with the partnership, how will the school be run, and where will those facilities be?
Well, the school, what we envision is probably the school will be a freestanding school associated with Xavier, in which both Ochsner and Xavier have equal partnership. The work that we have to do is the academic work and curriculum work will also be connected to all the other programs at Xavier as well, so that we have some synergy and the benefit of our crossing with the sciences and other fields as well.
And yesterday during the big announcement, you gave some eye-opening statistics on the number of Black healthcare professionals. Why is this something that we have such a great need for here, and just how proud are you?
Well, it's very important in Louisiana. It's also important for the nation, because the number that I gave of 5% of African-American doctors in the nation versus 13% of population has been roughly that number for decades. Wow. And we've not made great progress. And it's important for not only the issue of trust of patients with their healthcare providers, but also to fully understand how we address the disparities in healthcare that affect certain populations in this country.
And the partnership with Ochsner, will students stay within the Ochsner system when they graduate? Will that be a requirement?
No, students who graduate from medical school have the options to find residences throughout the country. Just as Xavier students, the fact that we have many Xavier students who will not be coming to this medical school, they will go to other medical schools as well. The fact that they have trained at Ochsner, they will know there's a basis for retaining them in Louisiana, so that many of them will do their residences in Louisiana, but some will go elsewhere. The choice remains with the student.
All right, President Verrett, thank you so very much. This is so exciting. Thank you for spending some time with us this morning.
It's a good thing for New Orleans.
Absolutely.